If you've reached your 60s or beyond, you've probably noticed something subtle. As you move through life, you don't just do so on autopilot anymore. You notice how your body responds, and you feel small changes sooner than you used to. And that's not a weakness, that's wisdom. Because as we get older, protecting your heart isn't just about avoiding emergencies. It's about paying attention to the quiet patterns that shape your health day after day. We talk a lot about food. We talk about walking, stretching, and staying active. We talk about stress, sleep, and mindset. But there's one area that often goes unquestioned, not because it's hidden, but because it feels routine. It's the medications you take, not experimental drugs, not rare treatments, but familiar FDA-approved prescriptions that many older adults take every single day, sometimes for years. And in certain people, in specific situations, some of these medications can quietly place extra strain on the heart as the body changes with age. This isn't about alarm, and it's definitely not about blaming doctors or stopping medications on your own. It's about awareness, one of the most overlooked senior health tips there is, because awareness gives you options. Today, let's gently walk through a conversation that many cardiologists and primary care doctors are already having more often. A closer look at a few common medications that deserve a second look after 60. Not to scare you, not to replace your doctor, but to help you ask better questions and protect your heart wisely. Before we go any further, let me ask you something. Have you ever noticed a new symptom? Swelling, fatigue, dizziness, fogginess, and quietly thought, well, this must just be aging? If you have, you're not alone. Many seniors live with subtle side effects for years without realizing a medication could be part of the picture. Let's start with one of the most familiar categories, pain relief. When joints ache, backs stiffen, or old injuries flare up, reaching for relief feels natural. Medications like ibuprofen, naproxen, and diclofenac, often called NSAIDs, are trusted staples in many homes. They're easy to access, they work quickly, and they're often taken without much thought. But after 60, the body handles these medications differently. NSAIDs don't just calm pain, they also affect how your kidneys manage salt and water. As kidney function naturally slows with age, even when blood work still looks normal, the body may start holding on to extra fluid. You might notice it as ankle swelling by evening, shoes feeling tighter than they used to, a heavy, sluggish feeling in your legs, or fatigue that seems to show up earlier in the day. These changes are easy to brush off, but fluid retention increases the workload on the heart. For older adults, especially those with high blood pressure, heart disease, or kidney concerns, regular NSAID use can quietly increase heart strain over time. This doesn't mean NSAIDs are forbidden. It means they're best used thoughtfully. Occasional use may be fine, however, daily use deserves a conversation. Many providers now encourage seniors to explore alternatives when possible: acetaminophen for certain types of pain, topical creams that don't affect circulation, or supportive approaches like physical therapy, stretching, heat, or gentle movement. Pain relief should support your life, not quietly complicate your heart health. You might recognize this pattern: a stiff knee one afternoon, a sore back after gardening, a headache that lingers longer than expected. So you reach for what's familiar, the same bottle you've trusted for years. And at first, nothing feels wrong. But over time, you notice small things. Your socks leave deeper marks on your ankles. You feel more tired by early evening. You sit down more often without really knowing why. Here's a question worth reflecting on, and there's no right or wrong answer. Have you ever taken something to feel better in the moment, only to feel a little off later in the day? If so, that doesn't mean you did anything wrong. It simply means your body may be asking for a different rhythm now. One of the most valuable senior health tips is learning to listen to those quieter signals. Not just pain relief, but how you feel hours later. Energy, swelling, clarity. Those clues help you and your doctor decide what still fits and what might need adjusting as your body changes. Now let's shift to a different category, one that affects sleep and emotional calm. Medications often prescribed for anxiety or insomnia, called benzodiazepines, are more common than many people realize. If you've ever had trouble falling asleep, staying asleep, or calming racing thoughts, your doctor may have suggested one. And for some people, they feel like a lifeline. You finally sleep, your mind quiets, and you feel some relief. But in aging brains, these medications can also slow reaction time, balance, and coordination. That's not a personal failing. It's biology. As we age, the nervous system becomes more sensitive to sedating effects. This sensitivity can increase fall risk, especially at night. It can contribute to grogginess or confusion during the day. And when used long-term, studies have linked these medications to memory changes and higher dementia risk. What makes this tricky is that the medication may still work. You're sleeping, you're calmer, but the cost may show up elsewhere, in steadiness, clarity, or independence. That's why many clinicians now recommend non-drug approaches as first-line support for sleep in older adults. Simple things, like consistent sleep schedules, gentle evening routines, morning light exposure, or structured therapy for insomnia that doesn't involve medication. And when medication is still needed, there may be safer alternatives worth discussing. The goal isn't to take something away, it's to protect what matters most. Now let's talk about medications many people take for digestive comfort. Proton pump inhibitors, often prescribed for heartburn or reflux, can be incredibly effective. They reduce stomach acid, they ease discomfort, and for short-term use, they can feel life-changing. But when taken for months or years without review, they can interfere with how your body absorbs nutrients. Stomach acid isn't just there to cause discomfort. It helps your body absorb calcium, magnesium, iron, and vitamin B12. When acid stays too low for too long, those nutrients may not get where they need to go. Low calcium can weaken bones. Low magnesium can affect heart rhythm and muscle function. Low B12 can contribute to fatigue, nerve issues, or brain fog. These changes develop slowly, quietly, and they're often mistaken for normal aging. That's why more doctors now encourage periodic reassessment. Do you still need the same dose? Could symptoms be managed differently? Is step-down therapy an option? PPIs can be helpful and sometimes necessary, but they were never meant to be lifelong by default. Relief today shouldn't quietly weaken resilience tomorrow. Now let's talk about heart and blood pressure medications themselves. For many seniors, these medications are essential. They lower risk, they protect the heart, they save lives. But the body you have at 75 isn't the same body you had at 55. Blood vessels stiffen, kidneys filter more slowly, sensitivity to dosage increases. A medication that once felt supportive may begin to feel heavy. Diuretics can sometimes lead to dehydration or electrolyte imbalance. Beta blockers may reduce exercise tolerance or mask low blood sugar. Calcium channel blockers can cause swelling or fatigue. And when several heart medications are combined, effects can stack up. This doesn't mean the medications are wrong. It means they deserve regular review. One of the most valuable senior health tips is this: prescriptions should evolve as you do. Managing numbers on a chart is important, but so is maintaining balance, clarity, and independence. And that brings us to the most important idea of all: not a single pill, but the combination. Polypharmacy. Taking 5 or more medications daily is extremely common among older adults. Each additional medication increases the chance of side effects and interactions. And the effects are rarely dramatic at first. They're subtle: lower energy, more fog, less steadiness, digestive changes, mood shifts. Many people assume this is simply what aging feels like, but sometimes it isn't. Sometimes it's accumulation, and many people don't realize how this builds. A pill added after a hospital visit, another after a new diagnosis, something to help with sleep, something to manage side effects. None of them seem dangerous on their own, but together, they can quietly change how you feel in your own body. Some seniors describe it like this: I'm not sick, but I don't feel like myself anymore. So here's another question to gently consider. When did you last feel truly clear-headed and steady? And what changed between then and now? For many people, the answer isn't age, it's accumulation. The reassuring part is this: when medications are reviewed thoughtfully, many people feel better without adding anything new. Less dizziness, more energy, improved balance, a sharper sense of self. Sometimes the path forward isn't another prescription, it's simplifying what's already there. A full medication review, done with a doctor or pharmacist, can be life-changing. Reducing what's no longer needed, adjusting doses, simplifying routines. Many seniors report feeling clearer, steadier, and more themselves afterward, sometimes for the first time in years. Because health isn't always about adding more. Sometimes it's about letting go of what no longer fits. With that said, let me ask you one final question. When was the last time your entire medication list was reviewed, not just renewed? That single conversation can protect your heart, your clarity, and your independence. And that's what this video is really about. Not fear, not guilt, but empowerment. Every day is another chance to care for the body that's carried you this far. Keep learning, keep moving, keep believing in your own strength. Because aging isn't slowing down, it's leveling up. If today's message resonated, take a moment to subscribe, leave a thought in the comments, or share this video with someone who could use a little encouragement. Because together, we're proving that aging well isn't the exception, it's the standard.